This suture can be compressed by a fall on or a blow to the face, for example. This could lead to a restriction in the orbit. The therapist is at the side at the patient's head, homolateral or contralateral to the dysfunctional side. The thumb and index finger of the caudal hand take a hold of the zygomatic bone. The index finger is intraoral at the internal side of the zygomatic bone. The thumb is external. The palm of the cranial hand is on the frontal bone passively. The index finger is on the frontal process of the maxilla. A lateral traction at the zygomatic bone is the invitation to disengage. The index finger of the cranial hand fixates the maxilla. A point of balance is established. One can give a fluid impulse from the opposite lambdoid suture. The thumb and index finger of the cranial hand take a hold of the zygomatic bone. The thumb is on the orbital face of the zygomatic bone. The index finger is at the lower edge of the zygomatic bone. The index finger of the caudal hand is intraoral under the maxilla's zygomatic process. The procedure is the same as in the previous technique. The therapist is at the side at the patient's head. The thumb and index finger take a hold of the greater wings. Index and middle finger of the caudal hand are intraoral, on both sides on the maxillae palatine processes. The greater wings are fixated in a neutral position. At the same time, the index finger and middle finger of the caudal hand spread apart. A point of balance is established. A fluid impulse can be given from inion. At the end of the technique, one synchronizes the movement of the maxilla with the movement of the sphenoid bone. During the inspiration phase, one follows the sphenoid bone and the maxillae into flexion and external rotation. During the expiration phase, one follows the sphenoid bone and the maxillae into extension and internal rotation. As in all other techniques, this technique can also be done in synchronicity with the primary respiration. During the inspiration phase, one gently promotes the naturally occurring disengagement at the level of the median palatine suture. During the expiration phase, one just follows the bones passively. Biomechanically, the horizontal lamina is supposed to move inferior and slightly lateral during the inspiration phase. The orbital process and sphenoid process move in an inferior direction, following the sphenoid body. The pyramidal process moves outward, inferior and posterior, following the sphenoid's pterygoid process. Biodynamically, there's supposed to be an anterior and inferior movement during the inspiration phase. The thumb and middle or index finger take a hold of the greater wings. Index and middle finger of the caudal hand are intraoral, on both sides on the palate bone's horizontal laminae, lateral to the median palatine suture. For an exact positioning, the fingers glide along the inner side of the upper molars. Behind the last molar, they are placed slightly medially on the hard palate. For a unilateral testing, one places just the index finger intraorally on the horizontal lamina of one palate bone. Testing of external rotation and internal rotation. During the inspiration phase, the middle finger and thumb at the greater wings give a gentle impulse in a caudal direction. As a reaction to that, the index finger on the horizontal lamina perceives a minimal movement in an inferior direction. During the expiration phase, the middle finger and thumb at the greater wings give an impulse in a cranial direction. As a reaction to that, the index finger on the horizontal lamina perceives a minimal movement in a superior direction.